I'm Jenna.
And I'm Jada. And this is Osprey News.
Today's topic is schizophrenia.
So please welcome our two experts, Diana and Jay.
Hello. In our study of schizophrenia, we went over the topic of symptoms,
Causes and treatments.
Statistics and stigmas.
History and types.
and here is a brief overview of schizophrenia in a video by the National Alliance of Mental Illness.
Imagine you're sitting in a room surrounded by 100 televisions, all on different channels with the volume turned all the way up. Now try to concentrate on one of the televisions. Try to make out one single sentence. Now imagine having that much noise in your head every minute of every hour of every day. Welcome to reality for 2.4 million American adults living with schizophrenia. Because schizophrenia manifests differently in every person, it might not be hundreds of televisions, but voices in your head that no one else hears, or different symptoms entirely. These distractions can be overwhelming experiences that lead to decisions and behaviors others find troubling. Schizophrenia doesn't appear to be linked to one specific cause. Studies suggest it could be the result of several interconnected factors, like brain chemistry, genetics, and environmental triggers. Thankfully, there are treatments which help manage schizophrenia, and, with the support of others, recovery is possible. You are not alone. We can help.
Schizophrenia is a psychological disorder that affects a person's thinking and perception of reality. Schizophrenia is a very serious disorder that can make a person feel like they have no control over their life.
Symptoms of schizophrenia can include delusions, hallucinations, disorganized speech, and disorderly behavior. Other symptoms can include irritability, always being on edge, discounting normal daily behaviors such as showering or brushing your teeth, trouble sleeping, or increased anxiety. And now for a closer look at the types of schizophrenia.
Thanks, Jada. Both Dr. Bueller and Dr. Kraepelin subdivided schizophrenia into categories based on prominent symptoms and prognosis. Even today, the people working in this field have continued to classify different types of schizophrenia. The 5 types of schizophrenia include disorganized, catatonic, paranoid, childhood, and schizoaffective. Disorganized is when the patient would have incoherent or illogical thoughts and speech. It is also difficult to perform daily activities, which can lead to frustration and agitation. Catatonic is where the patient either have excessive motor behaviors or decreased motor behaviors, such as talking or moving. Paranoid schizophrenia is when the patient may have false beliefs or delusions that an individual or a group of people are conspiring to harm them or the people they are close to. Childhood schizophrenia appears obviously during childhood and is very rare, with less than 0.04% of cases emerging. And the last one is schizoaffective. It's a combination of schizophrenia symptoms such as hallucinations and delusions, and mood disorder symptoms such as mania or depression. These 5 categories are still in the Diagnostic and Statistical Manual of Medical Disorders 4, but have little effect on predicting the outcome of the disorder and or diagnosing patients. Many researchers are using other systems to classify the types of disorders based on the preponderance of positive versus negative symptoms, the progression of the disorder in terms of type and severity of symptoms over time, and the co-occurrence of other mental disorders and syndromes. Now, back to the desk.
There is not a definite answer of what causes schizophrenia, but it is most likely drawn to a combination of genetic and environmental factors. Environmental factors can range from someone's experience in the womb to someone's experience as a child. These factors form abnormalities in the brain which cause an unstable level of dopamine and glutamate. Pregnancy complications like malnourishment or birth complications can also trigger schizophrenia.
While there is no way to prevent schizophrenia, there are treatments. With treatments, they can prevent symptoms from worsening. Treatments can include prescribed drugs, psychosocial rehabilitation, and family support. Forms of treatment for schizophrenia include various factors, such as self-learning about the illness, peer support, school and work, and finding the right supports and treatments that work for you. A special medication type is an antipsychotic drug, and there are two different kinds of ways that you can take it. There are typical and atypical. So antipsychotics can prevent delusions and hallucinations, but they also regulate the levels of neurotransmitters in your brain. So some people who have schizophrenia are inconsistent with taking their medication. So they are prescribed LAIs, which are long-acting injectables. These can be given at the doctor's office so that the patient doesn't have to worry about constantly taking their medication. Most of the time, schizophrenics do not get treatment because they feel alone. The initial recovery from symptoms can be very lonely, and it's very important that on their journey that they have peer support and a family network that can make sure that the schizophrenic is getting the help that they need and that you are supporting them.
Schizophrenia can be traced back to the old Pharaonic Egypt using written documents. In these documents, the people are recording what they are feeling and seeing. Back then, there was no condition that matched the symptoms of schizophrenia, but drawn from their writings, the symptoms they were experiencing would match the modern diagnosis of schizophrenia. Schizophrenia was first identified as a discrete mental illness by Dr. Emil Kraepelin in 1887. But the name did not actually come into place until 1911 by Eugene Buehler. Before it was named schizophrenia, it was called dementia praecox and was thought to be a different form of Alzheimer's. Buehler changed the name because he considered dementia praecox to be misleading. The word schizophrenia comes from the Greek roots of schizo, which means split, and phrenia, which means mind, to describe the fragmented thinking of the disorder. Since the name literally means split mind, it's often confused to be multiple personality disorder, which is where the stigmas of schizophrenia come into play.
There are some common misconceptions about people who have been diagnosed with schizophrenia. Some of those misconceptions and stigmas could be that those individuals are dangerous, that they could be violent, that they need to be kept away from society, that they could be an embarrassment to the family, or that every mention in the news is generally related to the cause of crime or violence. To really understand the public's knowledge about schizophrenia, we sent two of our best agents into the field.
And now to Jay and Diana.
All right, we're here today at the Town Center, St. John's Town Center in Jacksonville, Florida, doing a quick study and survey to see what the public knowledge knows about schizophrenia.
Did you know that there's approximately 1% of people in the United States who have been diagnosed with schizophrenia?
I did.
Well, we talked to some people out in the field, and here's what they thought about that statistic.
How many Americans would you say have this? Like a percentage, not like a number kind of thing, but like 4%. 4%? It's close. It's 1%.
That's still about 3.5 million people that have been diagnosed with schizophrenia.
How many Americans?
Oh, wow. Oh, my gosh. I know that it's probably quite a bit.
What would you... Like, ballpark?
What would you say? I don't know. 45?
45? Would you be surprised if I told you it was less than 1%?
Oh.
That's men. That's 0.2% of men and 0.4% of women.
Oh, okay, good.
Yes.
That's a good thing.
Men are at a higher risk for schizophrenia, at about 0.8% compared to women's 0.4%.
What percentage would you say of Americans are affected by schizophrenia?
More than they say out there,
There's
definitely.
about 1.5 million people diagnosed around the world each year. Even with treatment, there's still a 60% chance that after being discharged from the hospital that the individuals will relapse.
Wish there was more research done on it, and less of a pill. I'm gonna say that treatment to it, and some kind of other treatment besides just pills, because that's what it did to my relative. It turned my relative into a zombie, basically.
Sorry.
3 years after he started his treatment, he was not the same person.
And now this concludes our special on schizophrenia.
Thanks for watching!